The unmet medical needs of frontline therapy are really to assess fully the type of patient that you are dealing with. There are some patients who, even though we have these great advances in therapy, may not have the desired outcome. And now through the advances in genomics, we're able to identify genetic risk factors that seem to predispose to patients' outcome with any type of given therapy. One type of patient that we are focusing attention on are those that have mutations in the gene called TP53. These oftentimes have deletion in the short arm of chromosome 17 or deletion 17p. Associated with these genetic changes are an unusual heightened sense of genomic instability that can actually predispose to development of genetic mutations that might mitigate the activity of some of the newer targeted therapies. There are other risk factors too, but what's exciting to me is to see how poor risk genetic factors can be converted from being poor risk factors that seem to be poor prognostic risk factors to ones that are predictive of poor outcome with given types of therapy. And given the advances in treatment, either with newer targeted therapies or newer combinations, we might be able to convert those poor risk factors into good risk factors. I really like that. We've seen this, for example, in the setting of patients who have leukemic cells that have unmutated antibody genes versus mutated antibody genes. It's apparent that although the former category of patients may actually have a proclivity to progression and a shorter survival with chemoimmunotherapy, they seem to be responding better than patients with mutated antibody genes to inhibition of BTK. And that would be with the drug ibrutinib or the other BTK inhibitors. So this is quite exciting. We also have seen this with patients who have deletion in the long arm of chromosome 11. They were typically relegated to a category of having high risk or poor risk disease. It's apparent that with BTK inhibitors that their disease may actually be better treated, and therefore they may actually have a favorable prognostic marker for treatment with BTK inhibitors.